Cool. All right, guys, welcome to You Fix Pain. This is my beautiful wife, Vanessa. She's going to be joining us today, and we're going to be going over something called patellar tendonitis, and we're going to give you guys some tips and tricks on different things that you can do to fix that pain. And it just so happened that my wife was having knee pain just yesterday. So I'm going to go through my thought process and what my train of thought was on what could be going on with her. I'll show you how I assess it, so then you guys can assess it on your own. And then I'm going to show you guys some good stretches to help calm down your knee pain. So if you don't mind, Vanessa, if you can fill us in and tell us what's going on with your knee.
Yeah, so yesterday I was doing some squats and I started feeling a little bit of twinge of pain right below my kneecap. So I kept doing a little bit more, but it was one of those pains where I thought this is like not a good pain, that I don't want to screw up my knee further. So I stopped, and then I talked to John about it. And then so he started doing some assessments on me to make sure that we solved the problem of why I was feeling that not so good pain.
Okay. Do you mind pulling up your pants a little bit and just showing exactly where your pain is?
Yeah. So it's right here, and then this morning a little bit kind of up through here too, but mainly down through here.
So she's got pain just below her kneecap, and it's across the patellar tendon, and it's a very classic sign of patellar tendonitis. And she's also getting a little bit of pain. You get a little bit of pain above your kneecap?
Yeah, I just started today. It started really right below, and then as I was walking up the stairs today, I started feeling a little bit above my kneecap as well, and a little bit on my kneecap.
Okay. On it or underneath it?
Underneath, and then it's probably mostly like kind of right in here. So on it, I shouldn't say above it. It's above where my old pain was.
Okay.
But on the kneecap.
So those are all really common signs of patellar tendonitis like we were talking about. And so I'm going to walk you guys through how I assess this and what I would do as a physical therapist to help treat it. Now, one of the first things that I was aware of that she started to change in her daily pattern is her footwear. So she's been researching a lot of different shoes and what she should get. And so the first thing that I wanted to do was say, hey, what's that variable that she's changed recently that could be causing that pain? So she works out a lot. How many days a week do you typically work out?
About 5 days a week.
5 days a week.
Mm-hmm.
And what's your exercise typically consist of?
So I do like a 30-minute weights and like whole body sometimes. And then I'll do the Peloton a couple times a week as well.
Okay. So it's a lot of cycling, it's a lot of movement, but it's a lot of knee bending too. So we know that that's going to put more stress across that patellar tendon as well. So let's do this. The first thing that I wanted to look at, because she was looking at a lot of different shoes, is I wanted to say, hey, maybe it's these new shoes that are causing you a lot of the problem. And it's very typical when you start assessing or you start looking for new shoes and you've worn them for a little while that it can cause discomfort in your knee, your foot, even your hip or your back. And so I wanted to see how well the shoe was made. We don't get paid by these people. Maybe we should. But this is actually a really good shoe. So what I look for in a shoe is how much support is in it. Now, different folks have different requirements in their shoes. So it's not like a one shoe fits all type. But if you can throw one of your right foot up on the table and then bend your knee up, see if you guys can see it at all. Not really. If you can bring this leg back, let's go like that. Yeah, I mean, you can see a little bit of an arch there. Now, this is a really padded surface, but Vanessa, my wife, she has a really, not a really tall, but she has a taller arch, and it's pretty rigid. So what I mean by that is when you look at the foot, ultimately what happens is in most people, if they've got a tall arch, if this is the foot, this is the bottom of the foot, and they put weight through it and they stand up, you're going to see that arch collapse a little bit. Now, with her, it's pretty rigid. It doesn't move a ton. So I would suggest a more stable shoe for her. So when I talk about an unstable shoe, I'm talking about those shoes you can just bend in half and mold in a lot of different directions. But with a stable shoe, what you're going to find is it's got a pretty nice stable heel to it, and then you can't bend it a ton in the middle. You'll always be able to bend these shoes more in the forefoot, but not in the middle. And those will typically serve someone like Vanessa with her knee pain a little bit better. And these shoes are exactly that. They've got a nice little arch here, which most shoes don't, and it's also very stable here and in the heel, which are all very important for someone like Vanessa. So I really don't think it's the new change in shoes. So I think there's something else going on with muscle tightness around her knee or her hip, And so that's what I started looking into further yesterday. So one of the biggest culprits of patellar tendonitis is tight quads. So these muscles here on the front. And if she's doing all that biking and she's doing all this exercise with bending that knee, then it could definitely be a culprit. So first thing I looked at is tightness there. And so I want to show you guys how you can assess that on your own. Let me come over here. Let me see if they can see it okay. So I want you to lie down on your back. And sorry, go ahead and sit right here on the edge. And you're going to be facing towards that wall. Get your feet on the ground. There you go. And then you're going to sit right on the edge of the table. And then bring your right knee to your chest. Okay, and then you're just going to fall straight back. Okay, I call that the baptism move because as you can see, I just baptized her. So I'm going to slide you down just a little bit. Now, guys, you got to know that this is, I'm trying to make it so you guys can see this. But, okay, if you notice in her leg right here, it's nice and flat. So that tells me her hip flexors here are actually not too tight. But if you notice, I'm actually going to move this camera here so you guys can see it a little bit better. Got to get even lower. Okay, so if you guys can see here, her leg is sticking out a decent amount here. So that tells me that her quads are nice and tight. Now, go ahead and switch legs. All right. Now you notice the difference there, and you're not faking that, right?
No.
And your pain's in your left leg, right?
Yeah.
Okay. If it was in her other leg, I'd be in trouble. But so bring this other leg back down, and then this leg back up. So you can see the huge difference there, right? Her leg sticking straight out, and then go back to your other leg. And see how it just falls down? Well, guess what? All of her pain's on her left side, and her quads are extremely tight. So what we're going to do next is loosen that puppy up. So I'll show you guys how to do that. Let me get this camera resituated. All right, so let's go ahead and get into that lunge position like I had showed you yesterday. And you're going to be lunging. Let's see, your bad leg's your left. Mm-hmm. So yeah, facing that way, go ahead and lunge down. All right, and let me situate this a little bit better here so you guys can see. There we go. All right, so what I want you to do, and if you've got this pain at home and you've noticed that you've got a lot of tightness in your quads, one of the best things you can do is stretch out your quads. It's pretty obvious, right? But this is my favorite go-to stretch to take pressure off that patellar tendon, which keep in mind that patellar tendon attaches right at the bottom of the kneecap and down into your shin bone. And so deep flexion movements, deep squats, stuff like that is going to cause pain. So whenever you're doing these stretches, if you're feeling discomfort, don't keep fighting through it or else it's going to flare back up. So what I want you to do, Vanessa, is bring this back foot behind you a little bit further. Like keep on bringing it back. I want to see that there's a good stretch on this hind leg right there in the front. Do you feel that a little bit?
Yeah. Mm-hmm.
Okay. Now I'm going to have her push her hips forward just a little bit. Okay. Now she should start feeling a nice stretch across her quads on this side. Now, this is her bad leg. So I'm just going to show you guys how to do it first on her good leg, and then we'll switch and try it on her bad leg. So this is a classic quad stretch, but we're going to take it to the next level and we're going to turn it into a muscle energy technique. And so how we do that is we activate different muscles and then relax them, and it'll allow you to get further into the stretch. It's my go-to with any of these movements. So let's go ahead and do that. So you're going to lunge into it, keep those shoulders upright. Okay, and keep pushing that pelvis forward, and you're going to try to lift this foot up off the ground. Now, if you're on a hard surface, you're going to want to put something underneath your knee so it doesn't hurt, and you just hold it there for a couple seconds, right? It's not going to feel like you can really lift up your leg at first, but after you do it a couple times, you'll be able to do it. She's doing great, a little bit of shaking, that's totally normal, and then go ahead and relax that foot. Now, don't come out of it, stay into it, and actually, after you put your foot down, you're actually going to drop further into that stretch. You're going to feel a release in your hips, and you should be able to drop further into it. Did you feel that? Mm-hmm. Okay, so now what I want Vanessa to do is she's going to push her foot down into the ground as if she's trying to push that floor away. So go ahead and push, 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 just a couple seconds, and then you relax, and then drop deeper into the stretch. If you guys notice, she's going a lot further into it. A lot of people are going to be inclined to drop their shoulders forward. That's not what I want you to do. I want you to keep your shoulders upright and your head up, and you're just trying to feel a nice big pull across here. You shouldn't feel any sharp pain in your knee. So let's go ahead and do it one more time. Stay down on the stretch, pull that heel towards your bottom. Very good. If you notice, she's going up even higher, even though she's going further in the stretch. So that's a good sign. Okay, go ahead and relax. And as you relax, you should feel your hips release even more. Very good. Once again, you shouldn't feel any sharp pain, any pinching anywhere in the leg. Go ahead and push your foot down into the ground. Just a couple seconds. Push, 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 and relax. And then drop your hips a little bit further. I would do this about 3 to 5 times in each direction, and you'll find that once you get to the end range and you're not going into the stretch anymore, you just feel like you're hitting a wall, then you can switch to the other leg. Okay, let's try it on your bad leg. Okay, try to get this leg behind you a little bit more. Very good, I'll get out of the way here. All right, push your hips a little bit more. Now, one thing I'll point out, just as I'm assessing her, right away, I can see that her hips are more rotated like this. Now, what that tells me is she's compensating because of this pain. Or not pain, but because of this tightness. And so what can that cause besides knee pain? That can cause compression here back in the SI, or just low back pain, or even pain in the hips. It can make those muscles work differently. And so our end goal is to improve mechanics and get things moving back to normal. So I'm going to encourage her to level out her hips, drop into it. And you feel okay there?
Uh-huh.
Any knee pain?
No, a little pinching over here, but...
A little pinching? Okay, bring your right foot out to the side just a little bit.
This side?
Yep. Okay. That.
A little bit.
Okay. Turn that hip like this. Bring those shoulders back. Okay. Now go ahead and bring this heel towards your bottom. Very good. Okay. You feel a big stretch there in the front of the quads? Right up and through here? Very good. Just hold a couple seconds. Relax. Relax that foot. And then drop down in the stretch if you can. Very good. Are you feeling that pinching more in your hip?
Nope.
Okay. Very good. Is that pinching still there at all or not?
Not right now.
Okay. And are you having any pain in that knee when you lift that leg up?
No.
Okay. You sure?
Or like my kneecap?
Yeah.
I mean, just a little uncomfortable, but...
Like a 1 or 2?
Yeah.
Okay. 1 or 2 out of 10 is totally normal. So, so go ahead and lift that foot back up. Okay. Just holding it there just a little bit. Okay. And then hold it, hold it, hold it, and relax. And then drop your hips forward. Try to get further into that stretch. Very good. Are you feeling okay on that knee?
Yeah, it's a little uncomfortable, but...
Okay. So what we can do is we can grab a pillow. And it just so happens that we have a beautiful little unicorn from one of our kids. Let me go grab it. This will be our nice little support. All right. So once again, if you're working on a harder surface, then use something like a unicorn to take some of that pressure off your knee. Okay, is that better?
Yeah.
Okay, and no pinching in the hip?
Nope.
Okay, and if you guys can tell, I'm paying a lot of attention to pain. We're not trying to fight through it. There's some different stretches and things that we do that is going to cause pain. It's normal, but a 1 or 2 out of 10 in terms of pain is totally normal. 10 being the worst, 0 pain meaning nothing. But with someone like Vanessa, you can tell that she's kind of like fighting it. She's trying to shift her movement. And that's not something that I would want you guys to do. So we pulled out the unicorn. Okay, so lunge back into that stretch. Very good. Now, try to turn those hips just a little bit more. Keep that chest upright and your head back. Okay, now go ahead and pull your heel up towards your bottom again. Very good. You guys can just tell by looking at her that she's just tighter on the side. She can't even get her foot up as high. Just a couple seconds, then relax. As you relax, drop those hips further into it. Very good. Okay, now push that foot down into the ground. Very good. Push, push, push. Relax. Drop those hips further into that stretch. Very good. On a scale of 0 to 10, how big is your stretch right now?
Like a 4.
Okay. Go ahead and pull that heel back towards your bottom. Pull, 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 pull. And relax. And then drop down into it. Very good. Go ahead and push one more time down into the floor. Push, 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 push. And relax. And sink into it. Very good. And you're just feeling that pulling right up and through here, right?
Yep.
Cool. All right, go ahead and sit back up on the table. We'll get this resituated here. All right. And you're not too sore right now? It's not too bad?
No.
Cool. All right. So what I want you guys to gather from this is there's a lot of different factors that can go into cause knee pain. And it's not just always the quads, and it's not always just one thing. But with her, there's a big factor of quad tightness. And so we know that if we can decrease one of those variables in terms of tension on her knee, then it's likely to improve her pain. So something we should have done to start with is actually find a movement that would cause her pain. Now, most people with patellar tendonitis are going to have pain with deep squats. You can have pain with doing stairs. You can have pain with really any type of movement that's going to cause you to bend that knee back and forth. So just keep that in mind. And if you're getting that pain right below the kneecap or on the side of it or above it, it's a very classic sign of patellar tendonitis. And the first thing you want to look at is tightness in the quads. And hopefully you guys gain some insight on how to do that on your own. So please feel free to leave any questions in the comments below. I personally respond to everyone that I can, and we're here to help you. So let us know how we can. All right, you guys have a good rest of the day, and thank you, Vanessa.
Yep.